In this video, I'm going to explain what recovery typically looks like during the first 7 days after having hip replacement surgery. Specifically, I'm going to talk about what normal recovery typically looks like, so whether that's regarding your symptoms, pain and swelling, what your overall function and movement will look like, what type of assisted device you'll be using during that first 7 days, and more importantly, what movements or activities that you definitely need to avoid during the first week after surgery. I'm Matt Sigwa, a doctor of physical therapy, and I've treated hundreds of patients who had a total hip replacement. And if you're planning on having one soon, then this video is going to be especially helpful for you. Please subscribe to the channel before we get into the video. Now, let's get started. First, what are the common symptoms that you'll typically see in that first week of surgery? Pain and swelling are going to be the most common. Sometimes you'll have bruising around the incision site or even around the hip musculature, but swelling and pain and discomfort are the most common symptoms that you'll see. Now, person to person, that's where obviously it definitely ranges. So if you were to ask two different people who had the same exact hip replacement in the same exact hip, they're going to have different levels. There's just no way around it. Everyone's going to respond a little bit differently to the surgery, to recovery, to medications, to exercise. Body to body is going to be different. However, with everyone typically, and even if you compare the two individuals that we compared, there will be specific activities or movements that will definitely increase the pain and decrease the pain. So that's where we try to take advantage of the similarities between patients, right? So what we can do specifically to make sure that recovery for another person or any future patients who have this procedure is optimal, the least amount of pain possible and least amount of symptoms possible. So some things to keep in mind: the longer that you're standing and walking in that first week, you're going to increase the pain and swelling. Obviously, we do want to focus on walking daily, getting on your feet and standing that first 7 days. But if you overdo it, then that's definitely going to increase the pain. Now, that's why you want to work with a physical therapist who will be able to guide you and tell you what's appropriate for your specific level and your symptoms on a daily basis. Now, another thing that will also increase your pain is if you stay in one position way too long. So even if you're lying on your back, which is typically the least painful position, if you lie on your back during the day for 5 hours, like just straight through without getting up, without changing position, you're going to have a lot more stiffness. And when you try to move and get out of that position, it's going to be way more uncomfortable. So those are the two things you want to avoid: standing and walking too much and being in one position, whether that's lying down or sitting, for over several hours. You do want to do some kind of small movement, small exercise to break up that time, so then your symptoms are better. So what is your overall function going to look like? In terms of your home day-to-day activities, you're going to be more limited. You're not going to be doing any heavy lifting, so a lot of typical daily chores such as doing laundry, doing the dishes, so filling and emptying out the dishwasher, doing any kind of extreme bending. You're going to be avoiding all those daily activities, and you're going to be doing a lot more resting. Now, in terms of showering, you will be able to shower in that first week, but you have to be cleared by your physical therapist. One, they have to make sure that you can safely get in and out of your shower or of your bathtub, because then in general with the incision you're going to have a waterproof bandage over it, so that can get wet. It's not going to be submerged, but it can get wet, and you can be allowed to take a shower, but usually you're going to need a shower chair because you don't want to be standing when you're taking a shower. And you definitely want to have someone nearby or even in the bathroom with you to keep an eye on you to avoid any falls or mishaps. But before you can get cleared to do a shower, you have to make sure some showers or tubs have a little bit of a step you have to go up and over. You have to be able to cross that safely and be able to support yourself with good balance. So that's usually the limiting factor when it comes to bathing in a shower. You have to be cleared by your physical therapist so you're physically able to do it while abiding by your post-operative precautions, because like we're going to talk about later in the video, but there are certain movements and positions that you have to avoid to allow your body to heal appropriately and to keep your pain levels down. but your other functions in terms of walking from room to room or short distances with your assist device is going to be doable. Going outside to check the mail or going down the garage on some slopes or any kind of like incline and driveways, you want to avoid that until you're with your therapist who can make sure you have enough stability and you're not a fall risk, like your walking is pretty stable. But in general, most of your function is going to be focused on you being able to get in and out of bed safely and on your own, getting in and out of a chair or a recliner, getting in and out of the bathroom toilet or bedside commode almost independently. You might be modified by having to use your arms, but the goal is your function for that first week is you being able to independently do those transfers in and out the bed, those other transfers that we talked about, but we're still avoiding any heavy lifting, any extreme bending, and a lot of those other daily chores until you're possibly into the 2-week plus stage of recovery. Now, when talking about assisted device, that first 7 days after surgery, it's strongly recommended that you are using your walker. So usually that's going to be your front wheel walker. So 2 wheels in the front and then 2 stable legs in the back. Some people will try to advance and get to a cane, quad cane, single point cane quickly, but it is highly recommended, and especially based on my experience with working with different types of patients who had posterior, anterior, anterolateral, all the different types of hip replacement, it is just best in terms of your recovery to just stick to that walker during the first 7 days. So you might be physically capable of having good balance and being able to manage by using just a cane, but in that 7 days, the priority is really just to allow that tissue to heal so you get a better recovery. We want to reduce the inflammation and swelling as much as possible, and just using that walker is going to help you do so. So that first week, the assist device is a walker. Lastly, and most importantly, are the things and the movements, the positions that you want to avoid to make sure that you heal optimally. So in terms of movements, if you had an anterior hip replacement, so if your incision is on the front part of your hip, you do not want to let your leg, your surgical leg, go behind your body. So if this is my leg, I do not want that leg to go behind my body, and especially with my toes pointed out. So that's if you had it in the front. So don't let that leg go behind your body with the toes out. So one of the main situations that you would see this in is if you tried to walk very fast with large steps. So if you took a really large step and then that leg that you had surgery on is going to be behind you with a big step, then that can cause essentially it's going to slow down the healing at the incision because you're going to be putting a lot of stretch on it. But also if you were to do it very extremely, very fast and with a lot of force, there is that potential of possible dislocation of the joint. Usually it's not super likely, but the first week, that's when you're going to be at most risk for it. So not letting the leg go behind your body, especially with the toes out. If you had the hip joint replacement where it was posterior, so essentially on like the back of your hip or the back of your butt, the main movement or position you want to avoid is extreme bending. If you're bending down, doing like a deep squat, so the main situation that you commonly see this in is people who try to stand up from a low chair or from a sitting position. They'll really bend forward, let their chest go over their knees, and then that's going to cause a lot of stretch in the back where that incision is for the posterior approach, and it can lead to the same type of results as if you did the opposite with the anterior approach that we talked about. So there's some other positions that you want to avoid too, but those are the main positions for each of those approaches. So again, if you had it in the front, do not let the leg go behind your body, especially with the toe turned out. And then if you had it on the back side, so the back of your hip, the back of your butt, you want to avoid extreme bending forward. So not letting your torso get close to the top of your thigh. Now, you're going to have specific precautions based on your own orthopedic surgeon. They'll typically go over that with you, whether that's their PA or the actual orthopedic surgeon. They're going to go over that pre-surgery, typically after surgery, and usually you'll be sent home with some paperwork that'll say make sure you avoid these positions and movements. So every surgeon is going to have their own specific protocols and precaution, so make sure you follow that. But those two movements, according to the two different approaches, those are very general rules that a lot of orthopedic surgeons go by. So just keep that in mind to make sure that you have the best recovery as possible.